Hi, welcome back to our Unclenched podcast. I think this is episode 10. So today is a real special broadcast because we have no guests. It is just me and Priya, and we're going to answer a lot of questions from you, the viewers. So usually we only take a couple questions, and we have been getting a lot of feedback that that's just not enough. 2 questions at the end just doesn't get it. So here we go. And it'll be interesting to hear and compare and contrast what Priya and I both say. We might be a little bit different. We practice a little bit differently, but the same more or less mindset. But before we get started, I want to catch up with Priya because it's been a little bit of time. And how you doing, Priya? What's going on?
Oh, well, things are good. I actually, I think probably one of the more exciting things that's happened is I was asked to be on NBC, so
Oh,
nationwide
get the heck
news.
out. And you
Yeah.
didn't invite your girl Alex to go with you?
Girl, I
What is
barely
wrong
got
with
on
you?
there. Next time. Next time, definitely. It was a really, really neat experience. 30
Uh-huh.
Rockefeller Center, and they sent a car to pick me up. They sent a car to take me to the airport afterwards. And I mean, it was exhausting because it's a 3-hour time difference, and I
Sure.
was just there for like a little over 24 hours, but it
Uh-huh.
was a really neat experience. I got to meet 4 of the amazing anchors and just
So
talk
what show were
TMJ.
you on?
It was like NBC nationwide news. I don't know what channels are because we don't have real channels at home.
Yeah,
But
yeah, yeah.
yeah, it was really cool. I'm actually linking it was 2 different segments. And so I'm linking them onto my YouTube channel. So I think one of them just posted today, and then the next one will be in a couple of weeks. So it was
Oh,
pretty
I
cool.
can't wait. I
Yeah.
can't wait.
Yeah, it was really neat. And then I know we always talk about patients that stood out to us. So I had
Uh-huh.
one patient this week, Rob. He came to me with pain with chewing on his right side, popping that had gone away, and he couldn't open fully. He had ear pain, dizziness, headaches, stuffy ears on both sides, just very uncomfortable. And so basically we determined that his jaw was locked closed. His disc was displaced without reduction. So we started my treatment. I'm trying to look back right now and see when we started it. But I saw him just this week and he's like done. So we started in October of last year,
Oh,
mid-October.
wow.
Yeah. So it takes a while, I've found, for the jaw to unlock.
Mm-hmm.
And so I always start with a daytime and nighttime orthotic. I do a lot of hands-on therapy with a very specific, gentle but effective manipulation of the jaw, muscle releases, and then I check and adjust the orthotics right afterwards. And I found that at the beginning, when I see those patients once a week, we get a lot of progress. And then as they get better, as it starts to click and pop again, because it will usually, we are trying to reverse what happened, they start to open up more. The pain goes down. Then I see them every 2 weeks, then every 3, then every 4 till we can release them from active treatment. But I always tell these patients that treatment will take anywhere from 7 to 9 months. It's not an overnight process. It's not like a quick chiropractic adjustment and suddenly everything's back in alignment. That's just not how it works. So, anyways, I saw him this week. He is pain free, can open all the way. Even the clicking and popping is gone. So it was clicking and popping again for a while through treatment, and now it's gone. So he's doing
Uh-huh.
like really well. He's thrilled with treatment. He said, "Thank you for everything you did for me." And it was very gratifying to hear that. But it's just so exciting that he can chew, he can speak, he can yawn, he can kiss his wife, he can, all the
Yeah,
things that
sure.
that are part of our everyday lives. But what about
Yeah.
you? What have you been
Yeah.
up to? And tell me about a patient.
Well, okay. So I haven't been up to a whole heck of a lot. I've been a little bit boring. We've been spending a lot of time in our yard, and my husband got like a ton of rock delivered. And guess who's moving the rock? This old woman and my husband. But we finally got it all done, and the yard looks great. And
You are so
then,
much cooler than
we
me. I would be
what's
like, I'm
that?
not moving any rocks. It
I
ain't
know, but
happening.
it's a good workout, and the weather's been so great here in Pittsburgh that
Right.
actually we do kind of like enjoy that kind of stuff. So we haven't gone anywhere, haven't done anything fantastic or anything like that. Haven't been on NBC, but years ago I was on the Dr. Oz show.
Hey, I didn't know this.
Yeah, I know, right? Isn't that funny?
About
So
TMJ.
so pardon me.
Was it about TMJ?
Oh yeah. It was about
Oh,
TMJ and then some other dental stuff, and yeah, so it is quite fun, and I get you. It's just it's fun,
you're
but
so cool, Alex. And I know that
I
you
know,
always say that I know that I'm like I remind you of you like 15 years ago or
yeah,
something.
right,
Yeah,
right.
and I'm like, "Well, I wanna become you in 15 years." So that's
Oh, you're
perfect.
so
I'm
sweet.
well on my way.
Oh, you're sweet. You're sweet. So a patient that sticks out to me, her name is Deb. Deb. Deb came to me, I don't know, maybe 5 years ago, and I made her an orthotic. She had headaches, she had pain, neck pain, not sleeping well, the same stuff we hear a lot of the time. And so she had this orthotic. And in the beginning, I check my patients like 6 months after, then I check them a year later, and then they know if they have problems to come back to me because those plastic orthotics will wear down, right? So um, I guess her orthotic wore down and cracked, but unbeknownst to me, I didn't know that, right? So she goes to her regular dentist, and of course, her dentist says, I can make you one of those for a lot less. So she gets one.
Oh, no.
Well, it just triggers her into more pain. So she found her way back to me, and I'm like, Deb, what's going on? And she's like, wow, I thought I could wear this other one. It was a lot cheaper, but obviously it doesn't work. So, people forget like how much pain they were in, and it is some kind of mechanism happening in the brain. Like people don't remember the pain like you remember smell, like you remember going into someone's house, or a familiar smell, and you're like, oh, this smells like such and such as cigar, or things from the past. Your mind will pull that, but your mind doesn't really get how much pain you were in. Well, she's getting it now. So she's
Well
back in the office, and we're making her a new orthotic. And of course, I got to take all new records and stuff like that. But I was glad to see her. And, we'll get her on her way and out of pain and get her straightened up again. But I don't think she's going to stay in an orthotic because she's like, I can't go through this again. And she's talking about once we get her out of pain, what another option could be, such as braces or restorations or what have you. But that's about what was going on there. But it was pretty interesting
well,
to
it's
say the
interesting
least.
too because, um, we are wired to forget pain. We
Right,
are. Like, we're just wired to forget it. We're
right.
wired to move towards pleasure and away from pain. So after we
Yep,
give birth, after these really painful experiences in our lives, our body forgets because I think we're supposed to. And
right,
so, it's very easy to forget pain because I think we're just wired to. So I'm glad she found her way back to you, though.
right. I am too. So let's get started with a couple
Yes.
questions.
Yes. So first question, does moving your mandible 2 millimeters or more to the front or forward help with pain? I'm gonna let you answer, Alex, and then I'll go.
Okay. So I feel it can, not with everybody, but I have had patients sit in my chair and say, when I bring my jaw forward, it releases or it relaxes. Well, you're stretching that muscle. You're getting blood flow to the muscle. You might even be recapturing the disc, so it can help. But how are you going to keep it there?
Yeah,
Right? Like
yeah.
we got to do something to keep it there. So that's where that splint, or like you use a daytime and a nighttime splint, or orthotic as we call them, that'll help you to hold your muscles in that forward position. But muscles have memory. They always want to recoil and go back to where they were, but we have to train them now a new position. So just trying to be like this all day long and hold your jaw forward isn't going to do it, because then you're going to start recruiting other muscles and get more pain. What do you
Mhm.
think, Priya?
Yeah, I have found a lot of people tell me that when they hold their
Mhm.
jaw forward, their pain goes down. Or, I even didn't realize I did this. When I started working with my mentor, I became more aware of this, and when I learned about TMJ, I posture forward all day. I had premolars extracted and everything pulled back, and I hold my jaw forward all day because it feels better. Intuitively, I think I figured that out at a younger age, and so, but I will say that moving the jaw forward, it can help with pain for some people. But there's other, like, I guess, planes or dimensions that are also important, like the right to left, which
Correct.
is what, our technology, the myotronics, the neuromuscular software that we use, Alex, helps us find.
Sure.
And it's not always where the midline lines up.
Right.
So it's
Right.
interesting, yeah. And so there's
Right.
the right and left component, the forward and back, and the vertical. So I think all of those are important to get right. And for some people, moving the jaw forward can help. But what a lot of people who make appliance, a lot of practitioners who make appliances do is they just arbitrarily yank the jaw forward and say you're good to go. And that's not going to
Mhm.
work for everyone. There's other
Right.
dimensions at play. There's other things at play that are important to
Right.
take into account. So
Right.
I think
So
that's
what
my answer.
Right. One, I want to add on to how you said the vertical, the side to side, and the anterior, posterior of your jaw. We also look at three other dimensions that are the pitch, yaw, roll. So it's kind of like you're trying to land an airplane. So it's really six dimensions that we're
Yes,
always looking
yes,
at, and
yes.
we're trying to figure out. And some of the scans that we do take on our equipment, and when you can see the jaw in real time as you're tracking it move, my patients are like, "Wow, I feel what's happening on that screen is happening in my jaw." So it's pretty neat, and it's pretty telling for sure.
Yeah. Yeah,
Yeah.
totally.
So we have another question, and it is about clicking. We get a lot of questions about clicking. And this one says, clicking at the joint, doctor says it's normal. Do we do something about it? Or and then there was another question too with a click, and they have the sounds but they have no pain, and why. So we can try to wrap up a click question with everything together. So um, I say when there's clicking, and Priya, you might disagree with me, but typically we can get rid of the clicking in the joint. Sometimes on the extremely wide open, like a yawn, and you're really going to that extra length, you can't always get rid of that click. At least I can't. Maybe you can get rid of all your clicks, but the wide open ones sometimes will come back, or you're going to open wide for a sandwich. But do you do something about it? I say yes, because I know, and I use this comparison a lot. If your car was clicking all the time you drove it around town, wouldn't you get it checked? Because I would. I wouldn't be want to be on a car trip, and I hear a clicking and then something happens to my car. So why wouldn't you treat your body with the same care as you treat your car, and you should get it clicked? And what's happening in the click is that disc is slipping off the condyle, or the bone where, and the disc is like a little lifesaver, more or less, right on top of that condyle, and it slips off and it gives you a click. But why is it slipping? And we've got to find that out through some other tests or through a bite that we can see. But what I have my patients do too is if they open and close with a click, and they're like, oh, and then I have them bring that jaw a couple millimeters forward, or the teeth edge to edge, and open and close in that edge to edge position. A lot of times that click goes away and you're recapturing the disc. And then the question on the click, but there's no sound or no pain. That's the same thing. I would still see what's going on, because a lot of times people will say, well, my click went away. And that could be scar tissue. You could have recaptured it, but it also can be scar tissue now that you're riding on in the joint. What
Yeah.
do you think, Priya?
Yeah, I mean, I think just because it's common doesn't mean it's normal or
Correct.
okay,
Very
right?
well
And so
said.
yeah, and so I think when the doctor says it's normal, maybe they mean common, but I still don't think it's okay because a single click or pop could progress at any point to becoming a painful click or pop, or the jaw locking where the disc actually isn't just coming in and out of alignment, click pop anymore. It's actually completely dislocated. And that can happen at any time to anybody for any apparent reason. That's what I found out. But it could also stay a single click or pop for the rest of your life. You could go to the grave with a click and pop, right? So it doesn't mean it's gonna progress, but it could.
Right.
And with them
It
being
could.
the most used joints in the body, of course you want to get that checked, just like you would get your car checked. Why wouldn't you treat your body with the same care?
Right.
Yeah, and
Right.
I do think the single click or pop, especially in later opening, is very difficult to get rid of. But it's
Okay.
interesting. Yeah, I found that too. But what's interesting is when the jaw locks and I get it unlocked, it goes through a phase of clicking and popping, and I can often make the clicking go away then at the end of treatment. And I don't really get why. I don't really understand it, but it's just a pattern I've seen. But the single click or pop is really hard, especially as it gets later in your opening.
Yeah. So you know that second phase, I do a lot of ortho,
Yeah.
right? So when you're going through ortho, I'll have people sometimes, because I've done the orthotic therapy and have gotten them in a comfortable position, and I've found that a lot of times during ortho, their click or pop will come back, but it's only a few months short term because in ortho you're kind of playing with a moving target because you're always moving the teeth. So they're going to hit a little bit differently, slap a little differently. Sometimes I can fix it while they're right there. Sometimes it takes a month or two to work things out. So it's funny because patients will go, "Oh my God, my click is back or my pop is back." And I'm like, okay, that's because your teeth are moving and your bite's moving, but we'll figure it all out. Just give us a little bit of time here. So that's kind of a funky thing. But one thing I use, back to what you said about your first patient, and they're locked. They were locked closed, you said?
Mhm.
Yeah. I use a pivot appliance. Have you ever used that?
You know what? I haven't, but I've heard so much about it.
Oh, game
Yeah.
changer.
Oh, girl,
Slam dunk it.
every time we have a podcast, you get me onto something new. What are you doing? I love it.
Well, we'll go over. I'll talk to you after about that because you can probably get that treatment down a lot. Like it's crazy,
If it can make it
crazy,
faster
crazy.
for
Oh
my
yeah,
patients,
oh yeah,
that would be amazing because
yeah,
I only know
yeah,
one way. I'm a one trick pony over here with unlocking the joint. So I
yeah,
only know my way. But if something can work faster, girl, for these
yeah.
patients, I will do anything.
Okay, I know you will. I know you will.
All right. So next question: does Botox help with TMJ? We're never going to stop talking about Botox, are we?
I know. I know.
All
Go
right.
ahead. You go. You shoot.
Okay, so I have put so much content out there about Botox. There's like a video on my YouTube channel. There's tons of stuff on all my socials, and Alex and I even did a whole Unclenched podcast about Botox, didn't we? Or it
Well,
part.
it was more about like the TMD band-aids.
Oh,
You know
oops.
what you
Okay,
can
I
do to
know.
kind
I'm
of
just
cover it up.
exaggerating because I'm annoyed with Botox,
But
but
it just felt like it. But
it
I
did.
know
It did
I
because
get
it's just
diarrhea at the mouth when we talk about Botox too.
Botox.
But
It's
go ahead.
just
You go first.
Oh, and I'm tired of it, and, like, I'm tired of people. I just had a dentist attack me about Botox, and he was saying that I'm acting like I'm superior. I was like, "I'm not saying I'm superior, I'm saying orthotics are superior to Botox. I'm not saying I'm superior to anyone." Anyway,
Right.
Botox, it is a neurotoxin at the end of the day. So that's that.
Correct.
There's no making that prettier. People call it a neuromodulator or something like that. It's a neurotoxin. So a lot of my patients, because I'm near Portland, do not want it. Everybody here is hippy dippy, holistic granola. They don't even want to talk about it. So I don't have to talk about it that much. But the few that do, Botox can help some people with pain. For others, it can make it worse. I think it helps the people who primarily their pain is coming from the masseter and the temporalis, which are muscles we can inject with Botox. If your pain is primarily coming from deeper muscles, like the medial and lateral pterygoid, deep in there, if you inject the masseter and the temporalis because you cannot inject those deep muscles with Botox, it's not going to help. And sometimes it can bring those really angry, deeper muscles to the forefront because now you've
Hmm.
masked the little amount of pain that was coming from these. So for those
Amen.
people, I think it can make it worse. And
Mhm.
lastly, if you have sleep apnea, which a lot of TMJ patients do, they have sleep disordered breathing. And if you have that and you're injecting Botox into the masseters every 3 or 4 months, it atrophies this muscle and it makes your jaw drop further back into your airway when you're sleeping, which will exacerbate, make worse sleep apnea. So I
Right.
don't mean to sound annoyed. I'm just annoyed with Botox. I'm
Right. And you
sorry.
you bring up a good point because the masseters and the temporalis are the main movers of the jaw, and those are the main ones that are injected with Botox. Yeah. So, one thing you have to remember about Botox too. There is a black box warning on Botox, which is the highest warning the FDA can place on the most dangerous drugs. The label went on Botox in 2009. Now, nobody seems to know that, right? All true. Fact. Fact. So we've talked about Botox, like Priya said in our podcast, and Botox is a botulism toxin, right? Which was used by Saddam Hussein as biological warfare. And in fact, the troops that got sent over to the Gulf were vaccinated against botulism. So, if people that were in the Gulf War and those troops wanted to get Botox, it wouldn't work on them because they already have the antibodies against botulism. And you got to watch out too, Priya, how many units of Botox? The FDA approves 40 units. How many times have you seen a patient that said, I've had Botox, 40 shots? And I don't know what a unit is, but I think you need to get that checked out because some people get it in their forehead and in their crow's feet. Well, you add all those up, you better ask them how many units is safe. And a lot of practitioners may not even know it because the little inserts in the box are so little you can't even read all the wording on it. So I'm not a big Botox girl. To get you out of maybe acute pain, I'd say okay one time. But like Priya said, it's a neurotoxin. It destroys the nerve endings at the neuromuscular junction. So in your muscles, you have these little nerve endings at the end of the muscle, and it makes the muscle um, it makes the nerve endings kind of go away, but the body, it doesn't really wear off because the body repairs itself and those little nerve ending comes back. And nobody's done studies that I know of, and if there is one out there, please correct me, but about what happens when it's done over and over and over again. And you really got to be careful not to get the Botox. It's always in muscle, but you got to be careful that you don't get anything in the bloodstream because they will be in a lot of trouble. And then I read something too about Botox, and if you have autoimmune diseases and the interaction isn't that great. So if you have any kind of autoimmune disease and you're wanting to get Botox, you got to be your own advocate and you got to look up and make sure that it's okay and it won't make your inflammatory process worse.
Yeah, and yeah, I didn't know that about the autoimmune stuff, or even when the
Mhm.
black box label was placed on
I
there.
know, right? I
Yeah,
didn't know
I didn't
that
know.
either. And
I
then
didn't
when
know any.
I'm like, oh my gosh,
Yeah.
that to me, that's kind of big,
Oh, yeah,
not
that's huge, and, I
yeah,
mean, I've used Botox on myself for cosmetic reasons, and I think I even posted about how I got injected into a vein, I got a big bruise, and, I'm
right,
actually tapering back from even using it because of all of this stuff, and so
right,
but I never
right.
recommend it as first line for my patients, ever, and
Yeah,
sometimes people will come in and their jaw will be locked closed, it's a serious condition, they're like, "Well, I just thought some Botox could fix this." I'm like, "No, it ain't gonna
yeah.
fix an alignment problem." So,
Right,
yeah,
right, and that's what we're always dealing with is the alignment.
the
So
alignment.
next question I have here is, how long does it take after treatment to actually start to feel better? Well, everyone's different, and I usually when I'm in my consults, I tell people to give me 2 or 3 months, um, and usually we can have a pretty good quick turnaround by then, and, everybody's different. Everybody's body's different. Everybody listens to direction differently. So if you're committed, we're always committed to help you, but you've got to be committed too to either wear your appliance or come to for your appointments, and you'll get a better resolve like that because most TMJ issues don't happen overnight. Sometimes locks do, obviously, but there are a lot of things that don't happen overnight, and they're just a building process in your body. But in the medical field, I know we've mentioned this before, but for something to be successful in the medical field, they say that 30% better is considered a win. But I know I don't settle for 30%. Because you get something better and then you're like, well, my neck. And we're like, okay, let's send you here. Let's get this better. Or my hip. Or, it can go on and on. So it's almost like I take responsibility for more than just this. So we're always looking to bring the whole body together. But yeah, I don't think it's just it's the same for each person. But in my office, I usually say 60 to 90 days.
Yeah. I usually say, yeah, like you said, it's different for every person. I had a patient who, so the way I used to do it is I would deliver the nighttime orthotic and then a week later the daytime one.
Hmm.
I had a patient who got the nighttime one and she was like, I don't even need the daytime one. I feel so good. And I was like, well, I made it, so you need to come get it. Like you paid for it, so you need to come get it. But she didn't even want to come back. She felt so good.
Yeah,
And she was having daily severe headaches. And then I've had people where it takes months to see a change. So
sure.
I typically tell people you'll likely feel relief within a month, month and a half. That's usually what I
Hmm.
see because I see them back frequently for soft tissue therapy. And I think that helps
Right,
just speed along the process. But
right,
yeah, it really varies.
right, right.
But yeah. Next question. Does TMJ cause lightheadedness? I'll let you answer first, Alex.
Sure, sure. Well, a poorly aligned jaw, like we're talking about alignment here, can put pressure on the balance organs in your ear and it reduces their ability to function and it
Yeah.
can cause vertigo, it can cause dizziness, and it's located right in your temporal bone, so that's where your jawbone and your skull attach. So
Yeah.
it can cause dizziness and you get inflammation around those muscles in the inner ear. Absolutely, it can cause dizziness.
Sure. Sure.
Yeah.
Yeah, I agree. I think that because the temporal bone, houses the structures for balance. When that temporal bone is yanked by a tight temporalis muscle or by a tight SCM, when there's and when those temporal bones aren't moving with each other. The cranial bones move, for those of you who
Correct.
and when they're not moving in sync or just they're being yanked on, it can really affect the structures for balance, which can cause dizziness, vertigo, lightheadedness, nausea.
Sure.
All of those things can come along with that. And so yeah, I would say the answer is yes.
Yes. Yes.
Yes.
Yes. Yeah. That's all we need to do is yes
Yes.
next.
Yes,
Yes.
yes. Okay, done. Bye.
Okay. Is it normal for TMJ to the back of your neck and head hurt? Well, I don't think anything's real normal about TMJ, but yes, that can happen. And Priya's just talking now with the temporal bones and how the bones move. And even if you take your finger and you put it right under the base of your skull and you move your jaw or you talk, you can feel those muscles moving. So it goes back to all of the connection and the muscle movement. It's not just you can move the muscles of your jaw without other muscles kind of joining the party. Um, there's just a head and neck connection. It
Period.
goes all
Mhm.
into the anatomy and the muscles and all of that. And one of the things too that Priya and I talk about too is like when you're moving your tongue and the fascia from your tongue and relating to your neck. And when I do tongue releases, 25% of my patients are like, oh my gosh, my neck just released. It's
Mm.
crazy, but the connection is there. Our
Totally.
bodies are amazing.
Mhm.
Priya, what do you have to add?
Yeah, I mean, back of the neck and the back of the head, definitely. I see a lot of people come in with occipital pain and neck pain at
Mhm,
the back of their neck.
mhm.
It can be due to, like, tight fascia because of the tongue tie. It can be due to
Right.
clenching and grinding activity. We can recruit so much muscle. It can be a postural thing if your head's tilted instead of being straight on your neck.
Mhm.
There's so many different things that can get your neck involved with all of this, and it can definitely then make the back of the neck or the sides of the neck or the back of the head hurt. So, yeah, I would say it is common in TMJ for the back of the neck and the head to hurt.
Yep.
So yeah, so next question, can permanent retainers cause issues with the TMJ? Huh. Permanent retainers, so that would mean like something cemented down here.
That's what I would think.
Yeah. Interesting. I've never thought about that.
Okay. Well, I have. because
Okay.
I do
Like,
braces
I don't know.
and I do use permanent retainers.
Yeah.
Now, so when you bond the retainer on the inside of the teeth, right? And your lower teeth close, if you're touching that permanent retainer, absolutely, because you touch it and your jaw deflects back.
Sure.
And that's happened with patients of mine. So that's why I know that it can cause TMJ problems. If I don't check the retainer very well and clearly, they'll be back to me and saying, you know what, my jaw's hurting a little bit. And I'm like, oh, must be something with the retainer. And when you're laying back in the chair and you're putting the retainer on, your bite is different than when you're sitting up in the chair. So I always make sure to check, how the bite is with those permanent retainers. But the other thing I think that happens with permanent retainers is some people that have tongue issues, they'll want to play with their permanent retainer or press on their permanent
Mm.
retainer. So then, if you're recruiting those tongue muscles,
Yep.
your neck, all of that comes into play. So that can cause it too. So I always, remind my patients, like, don't play with this. Tongue to the roof of the mouth, do your myofunctional exercises, things like that. But they can they definitely can, but you got to look more beyond the retainer. Well, you look at the retainer, but you got to look at the tongue positioning, the swallow pattern, all of that stuff too. But they can.
Interesting. I mean, it's interesting that we bring this up because I have a patient who's thinking of getting permanent retainers, and I told
Mhm.
her only get them if you're positive your bottom teeth aren't going to occlude against the upper permanent retainer mold.
Exactly.
So that's interesting, but I've never actually
Yeah.
experienced what you have, like where they've maybe come back with TMJ problems because it was hitting. But
Right.
the other thing, the reason we're asking her to consider that is because she has a lot of pain and she cannot tolerate wearing the daytime orthotic. So she's not getting better because she's not in a good position all day. And so we talked about doing the T scan with her, but she
Hmm.
wears Essex retainers. So those are the clear shell retainers that sit. I know. I know. So we
Yes.
checked her T scan with her natural teeth hitting, with the Essex retainers hitting each other, and then with her upper Essex hitting my orthotic. And the worst one was the Essex retainers hitting each other, which she had been doing for years before she came to see me.
Sure. Sure.
So it's been interesting because now my eyes have sort of been opened up to the T scan thanks to you. And yeah, those Essex retainers, man, they can really mess up the muscles.
Yes. So let me tell you a little bit about this too. So retainer wise, there is a retainer out there that will not go over the tooth surface at all. It's called a QCM. And
No. Okay.
yeah. So, and I'll give you my lab that makes them. So just make them a new retainer. They can wear that at night. And then their teeth are going to occlude like they're occluding during the day. So when you're doing a T scan, when I have a patient, because I have tons of patients that come in for a T scan, um, like you do, a T scan is a computerized kind of wafer that you bite on, and Priya and I can tell what surfaces are hitting, what's too hard, what's going on, and we can adjust your micro occlusion adjustments with this T scan. But then she'll still have the comfort of having a retainer, but
What the
nothing on
actual
the.
front door? How did I not know this?
Well, that's okay. We learn something new all the time.
Well,
We're
I learn
you
from
know
you every time. It's embarrassing. Shouldn't I know
no,
stuff?
it's not. No, it's not. No, it's not. But it's just works and it works well,
Wow,
and
I just looked it
nothing
up.
goes over the occlusal surface.
What the freaking
So you
Okay,
don't have, because remember those old wire retainers, those Holly
yeah,
retainers? Then
yeah,
they had a little bit of wire that went through the bicuspids. So when you bit on that wire, so that threw your occlusion off. But these
yeah.
QCMs do not. Gotcha.
Wow. I
Yeah.
I'm just blown away. Like, I'm looking at them and I'm like, "I need to get this," because that is gonna be the answer for this patient. So, wow. This is so exciting. Dr. Alex, I'm gonna look into this for one of my patients. So,
Good.
but I know we need to move on to the next question. So I think
Okay.
that's you. Yeah.
Okay. So, next question. My doctor says I have tired muscles and I need some strength, but is it helpful? Hmm. So, this is my thought. If your muscles are tired and you need strength, first of all, you have to have a professional helping you increase the strength in those muscles. It could be a very good PT, somebody that understands TMD. Um, if you keep working a tired muscle, you're just going to fatigue it more too if you're not doing things properly. And you have to remember each muscle starts in a bone, inserts in a bone, right? So you're moving those bones when you're increasing the movement in those muscles. So if you're in bad alignment, you could be doing more harm than good. What do you think, Priya?
I agree. My mentor, like, probably the first thing he taught me was TMJ. When there's so much pain and dysfunction, it's more about not doing than it is about doing. So he's like, a
Correct.
lot of people come in and they want to exercise these muscles and make them super strong, and they think that that's going to help them to feel better. But that's just not the case. Like, these muscles are
Mhm.
so overworked and they're in such a dysfunctional state. And then you're
Yeah.
exercising them. Like, it just doesn't make sense. And it often makes the pain a lot worse. And so even certain exercises, like if you're trying to build up your shoulders, a lot of us, most of us, involuntarily recruit the neck muscles. We don't mean to, but it just happens. Like, if we lose our form for just a moment, and overworking those muscles makes the TMJ worse. I see it time and again. And so I think exercising the muscles, yeah, maybe they're weak, but they're dysfunctional. They're already overly exhausted, metabolically exhausted. They've built up toxins, lactic acid, they're super sore, and then you're giving them a workout. Like, it
Right.
just it does, it's not going to bode well. So I don't think exercises are the way to go. I think massages, muscle release, myofascial release is the way to go. And if you notice on my social media, I never call them exercises. I call them muscle releases and massages and myofascial release, because I don't want to I don't want to encourage anyone to exercise these muscles when they're in
And
pain.
and overwork them. They're
Yeah.
already, like you said, overworked, and we can tell that by our scans that we take in our muscle, like the fatigue
Oh,
and
yeah.
oh,
Yeah, I
yeah,
mean, that we hook our patients up, and we measure how their muscles are firing. And when I
right.
did this on myself, I noticed that my left temporalis was crazy high, and that's where I get headaches. That is
Sure.
literally where my headaches are. They throb there. And
Yeah.
so, my orthotic, when I measured myself, I made sure that all the muscles were firing well and low, but
Mhm.
especially this one is what I was looking at. I was like, I gotta get that one to fire really low. So, yeah, I think that exercising the muscles is not a good idea if you have TMJ problems. So,
Right.
next question. Let's see here. What physiotherapy, so that's physical therapy, that's how they
Mhm.
say it in the UK, I believe. What physiotherapy is good for the jaw? Ultrasound, IFT, or TENS? Take it away, Alex.
Oh, alright. So, I'm not extremely familiar with IFT. I know that's it's like an electromagnet or electrotherapy used to manage pain. So I'm not familiar with that, but I do use in my office definitely the tens, but you gotta watch out what tens you're going to use because there are different types of tenses. There are what we use in ULF tens, ULF, ultra low frequency tens. So with that tens, what it does is it relaxes your muscle without fatiguing it. Other TENS is like when you go to a physical therapist, they'll use TENS that are for your back or your knee. And what they'll do is they can TENS you, but they're not relaxing the muscle. They can fatigue the muscle. Not all tenses. You have to talk to whatever therapist you're going to, but you need an ultra low frequency that's going to relax the tens without fatiguing the muscle. And then there are other tenses too that are for pain blockage, and a lot of those you don't put on your face. So there's so many out there. I know what we use works and won't fatigue your muscle. That's the most important. Now, with the ultrasound therapy, that's good to increase blood flow. I use in my office beamer therapy, which is an electromagnetic blanket. that I seem to get results with that very well. I use a laser, a cold laser therapy, and that really is nice for trigger points or hard muscles. And when you use that over the muscle, the patient almost immediately can feel it release. So I do like cold laser. I do like an ULF TENS. I do like electromagnetic therapy blanket. I think they're good. There are other things like red light saunas, I think would be good, but those are all very short lived. Those were probably on our Band Aid of TMD episode. They're good for a short period of time. What you really have to get in there, and you've got to make sure the structure and the muscles from one side to the other are moving correctly. What do you
Yeah.
think?
Yeah, I mean,
Yeah.
the main one I'm familiar with here is the ultra low frequency tens, the ULF
Yes.
tens. That's what I use, and it's interesting. For some people, it's kind of like poking the bear, like it makes things a little worse in the short term, like when the first
Mm-hmm.
5, 6 times they use it, because those muscles are so angry, and now we're like bringing a lot of attention to them, right?
Right.
Um,
Getting blood flowing in there.
yeah, yeah, and, like, sometimes that can manifest as more pain, but other people, they feel relief right away. They're like, "I've never felt as good as I did after I left that appointment with you when you did the TENS," and then
Yeah.
that'll encourage them to buy it. They want one at home. So,
Sure.
I know
Sure.
that and even the people that experience pain at the beginning with TENS, once they've used it enough, they start experiencing relief with it. So once
Mm-hmm.
I think the muscles get healthy enough, they get the full benefit of the TENS in that they get the relief too. So I'm not
Mm-hmm.
familiar with the other 2. I don't use the cold laser or electromagnetic blanket, but again, getting lots of ideas. Um, so yeah, next question, I guess.
Okay. Next question. I have a lot of pain in my neck area, and will gym or swimming aggravate it?
Ooh. So I think that again, working the shoulders can aggravate things. I think that some of the moves when we're working our core, when we're holding our neck up, sometimes we recruit the muscles of our neck too much. So being
Mm-hmm.
careful with those. I feel like those exercises and certain yoga poses where it really causes you to like twist, that can aggravate things. And even swimming because your neck during certain strokes is
Sure.
at an angle. Yeah.
Sure.
Um, and then
Yeah.
running, I've found a lot of my patients say running actually helps because I think you're in the right alignment. It's really hard to run with like totally forward head posture, right? Many people are in better alignment when they're running than they are when they're just like sitting at a computer or sitting watching TV. And so I think that actually I've found running or walking to help. But what about you,
Mm-hmm.
Alex? What do you think?
So I agree with you. You got to watch your neck. Like I'll have patients that'll say, I go to the gym and my neck hurts. Well, are you doing the exercises right, and are you recruiting the right muscles at the right time? Like when you do clenches and you have your head behind, I mean your hands behind your head and you're pulling forward, you better be using those ab muscles. That's what the clench is for, not to take the stress in your neck. So you got to make sure that when you're doing an exercise for a certain muscle, you're not also recruiting other muscles to help you because they shouldn't be, and then you're working out wrong. So
Right.
you might want to get like a trainer or someone that will help show you how to do exercises. Like my husband will exercise, and he does those kettlebells. And when he's doing that, he's swinging his whole body. I'm like, what are you doing? But of course, he doesn't listen to me because he's my husband. I'm like, just use your arms. Like, you're doing too much momentum. Like, and
Yeah.
that's not good. But, he's my husband and he's going to do it differently than what I tell him.
Yeah.
So, what are you
Totally,
going to
I
do?
know. I feel like spouses, it's like we just don't listen to each other. It's just that's
Yeah.
how it goes.
Yeah. Yeah.
Let's
Yeah.
see. What is retrodiscal edema? Wow, that's a very specific question.
Mhm.
Go ahead, Alex, you can take it away.
Well, thanks, Priya.
It's
So,
swelling behind the disc.
right. That's all
It's
it is.
literally that's what it is.
Retro behind
Yeah,
discal disc, edema, swelling.
swelling. Yeah,
That's about as much as I can do with that one.
me too. Yeah, I'm like it's a very specific question with a very specific answer. It's literally
Yeah.
swelling around the joint.
Right, right. This is a good one, I thought. Is TMJ connected to period pains?
Mhm. So there is a hormonal component to TMJ problems, and that is
Mm-hmm.
why women experience it more than men.
Mm-hmm.
Now, during our menstrual cycles, our hormone levels fluctuate quite a bit, and for many people, their pain gets worse during periods.
Mm-hmm.
But that's really any pain. I think we're just everything is more sensitized. It is. I mean, that's like
Right.
proven when you're on your period, everything is heightened, and that
Right.
includes TMJ, TMD pain.
And your mood.
Oh yes, the moods.
No, but with period pains too, think about it. Like your body is inflamed everywhere, right? So your body, you're bloated, there's inflammation. So the period pain just doesn't stick to your pelvis area. It's throughout your body. And the inflammation around your joints is going to be heightened for sure. So that's a good question, because it goes back to how Priya and I try to connect the whole body to what's going on, and we don't want to have you think like everything is TMJ,
Right,
because
right, right.
you know it's not. There are other issues that can be going on, but we're talking about TMJ, so we're trying to tie it into that, but we don't want you to think every single thing is TMJ that's going on.
Yeah, we definitely don't want you to think that. So these have been so many great questions. Thank you guys for posing these to us. It really makes us think and collaborate and come up with ideas. And I know my practice has improved because of this podcast. So unfortunately, we can't get through them all. We still have more questions lined up. So we're going to do another episode just like this. And we're super excited to do that. So keep the questions coming.
Yeah, keep the questions coming. We are excited. We got to get on to some other things that we're thinking about and collaborating on. So keep the questions coming. We promise we will do another question and answer podcast because we have a ton we didn't get through. Thank you so much for listening, and hope that you tune back in for the next podcast.
Yes, thank you.
Bye-bye.